For those of you who may not know, Northern Ireland is geographically located on the island of Ireland, but yet is part of the United Kingdom. Nursing and midwifery practice and education, therefore, is regulated by and applies to the standards in the United Kingdom, which I will talk about later. We have a population of 1.8 million, and it is a great place to live and work. At the outset, it's important to consider the wider context that is driving the advancement and development of nursing and midwifery practice, globally, nationally, and regionally. The three strategic publications on the slide illustrate how the connections connect in the context of workforce challenges on a global, a national, and a regional level, and provides a three-dimensional lens that expands our professional vision and enables us to effectively articulate the voice of nursing and midwifery at policy level. Firstly, we have the WHO Global Strategic Directions for Strengthening Nursing and Midwifery. Secondly is the All-Party Parliamentary Group Triple Impact Report, which was UK-led but applies across the world. And thirdly, the recently published Northern Ireland Midwifery and Task Group Report, which sets the strategic direction for our professions over the next 10 to 15 years. All through these reports, you will see that workforce is the predominant theme, highlighting the need for workforce investment to address recruitment and retention and to develop new nursing roles in order to tackle health inequalities and improve the health of local and global populations. There is no doubt that the International Year of the Nurse and Midwife and the COVID-19 pandemic have demonstrated like never before the valuable contribution nursing makes to global health and the pressing need for strengthening investment in the nursing and midwifery task force. Workforce. Elizabeth Iro, the Chief Nursing Officer in WHO, recently presented this slide at an ICN webinar in January to discuss the new WHO draft strategic directions on nursing and midwifery 2021 to 25. But the history highlights the tremendous global work and influence that the World Health Organization has and spanned over 70 years of leading and driving forward nursing and midwifery practice into the development of a new nursing roles to improve global health. It shows how our professions, just go back again, sorry. It shows how our professions has developed over time and still has the potential for further development into new and exciting roles to allow clinical practice to be married with population health planning to improve the health of the world, to improve multiple morbidities for our populations, to provide person-centered care and to provide good outcomes. Next. The nursing and midwifery practice in Northern Ireland is regulated, as I said, by the UK regulator, the Nursing and Midwifery Council. The NMC regulates across the 4 countries of the UK, Northern Ireland, England, Scotland and Wales. Specialist nursing practice is regulated by the NMC with a recognised standard and qualifications. A nurse who, upon successful completion of a specialist practice programme, gains a recordable qualification annotated on the professional register. Advanced practice, however, on the other hand, is not currently regulated. The NMC has recently been undertaking a comprehensive review of its existing post-registration specialist practice qualifications and standards, seeking the views of UK and to practice and has progressed and developed, how that has progressed and developed in recent years. The review has raised different views about highlighting the expansion of nursing practice and nursing roles in response to changing healthcare demands and strategic direction towards much more community and primary care based. The next step will be a consultation, and through the review of specialist practice standards, a growing number of senior nurse leaders and professional organisations have highlighted the need for regulation of advanced practice. The NMC have not made a final decision on this yet, nor stated their intentions. And if we do move to regulate advanced practice, there will certainly be debate around definitions of advanced practice and specialist practice. I had planned to ask the audience a poll at this point, but I'm not sure that we have time for it. Happy to proceed.
Yeah, please proceed.
Happy to proceed.
Yeah, thanks.
In Northern Ireland, we have taken an approach to developing professional career pathways in specialist, advanced and consultant nursing roles. that provides clear definition of roles, describes different levels of practice, distinguishes practice components, and ensures regional role consistently and standardization of practice. So I'm going to hand over to Heather now to take you through the framework document from the Northern Ireland Practice Education Council.
Thank you, Charlotte. And I'm just going to go back just to sharing the screen here, just while I unmuted myself. Okay, thank you. Further to what Charlotte has already described, in Northern Ireland, we have developed 3 key documents to support each of these defined roles and levels of practice. They are a career framework for specialist nursing roles, an advanced nursing practice framework, and professional guidance for consultant nursing and midwifery roles. These documents describe the different roles and levels of practice, which all interconnect and complement each other to maximise the contribution of nursing to improve patient outcomes. This approach also supports the Northern Ireland strategic priority, which is currently to transform how public health and social care services are delivered to our local population. Our strategic transformation roadmap featured on the slide is Health and Wellbeing 2026 Delivering Together, alongside our Nursing and Midwifery Task Group report. Both recognise the importance of investing in specialist, advanced and consultant nursing roles to effect transformational change and improve and enhance population health. We have a Northern Ireland Clinical Practice Career Framework, which distinguishes between the different levels and roles, specialist, advanced and consultant nurse midwife. This grid helpfully sets out the components that differentiate the levels of practice. While some practice components are similar and some overlap, this grid sets out the parameters which distinguishes the core practice characteristics of each role. These are identified under 4 headings: clinical practice and scope of role, service improvement, education requirement, and supervision requirement. Turning now to focus on advanced practice, I have played a lead role in overseeing the development of advanced nurse practitioner roles and the successful establishment of the first locally available advanced nursing practice programme in Northern Ireland. Soon after the development of the Advanced Nurse Practitioner Framework, the Strategic Transformation Agenda was also published, providing a window of opportunity to align professional practice with policy. This ensured both political and strategic buy-in and secured the commissioning to develop an advanced nursing practice master's programme in 2016. And prior to this, Northern Ireland staff had to access these programmes from the UK mainland. Following regional partnership working with key stakeholders, a 2-year full-time MSc programme was developed through our local Ulster University, offering 3 ANP pathways, and the academic fees were fully funded by the Department of Health here in Belfast. The first programme of 20 AMP students then commenced in the autumn of 2017, and the first locally trained advanced nurse practitioners successfully graduated in 2019. The key emphasis of the programme focuses on advanced nursing practice through a nursing lens to maximise the unique person-centred contribution that nursing brings to patient outcomes. Since 2017, we have now a total of 5 AMP pathways developed in primary care, adult, children's, emergency care and mental health. Our strategic direction continues to support the development of advanced nurse practitioner roles and see them established more widely as we implement the recommendations of the Nursing and Midwifery Task Group report. I'm going to now play a clip of an advanced nurse practitioner describing her role in primary care, and hopefully this will work for everyone.
Well, as a student nurse many years ago, I really enjoyed my community placement. I think during that placement I was able to see that the nurses in general practice and primary care were able to treat the whole person. They knew the families, they knew the environment that the patients were coming from. They saw all ages, all conditions, and were able to provide that complete episode of care. And at the time I thought, I want that I could see the value of it. It also showed that you could be an autonomous practitioner in general practice, but you were very supported by the multidisciplinary team and the general practitioners in general practice. Well, my most memorable and special moments, suppose plural, from training as an advanced nurse practitioner has got to be the patient feedback. Initially, patients weren't really too sure what an advanced nurse practitioner was, along with most of the staff, if we're being honest. But once they have made that initial contact and came for that initial consultation, they started requesting appointments with me. I mean, that is such a compliment, because you're given the choice to patients. It's not that they have to see you, they actually want to see you. The advanced nurse practitioner role is a fantastic role. It improves access to high quality healthcare to patients across all ages and all conditions. It's a very mentally stimulating job. We could range from providing face-to-face consultations to telephone triage. We see patients in their own home. You're really providing that complete episode of care for patients, and it keeps you motivated and keeps you stimulated, and you're always learning. In my role of developing the 3 further domains of advanced practice, I will provide leadership and encourage that collaborative practice between not just the nursing team, but the wider multidisciplinary team. I will promote and participate in ongoing education and learning, whilst contributing to that evidence base by current research within the general practice. Well, firstly, there is no typical day. That is one of the benefits of this job. Nothing is the same day in, day out. I could be spending a morning doing booked appointments, could be emergency appointments added into that. I could be doing telephone consultations or following up on sort of blood results or other investigations that I've requested. I also have the privilege really of being invited into patients' own homes and looking at care planning, or whether it's for an emergency house visit. I could also spend a day going into our nursing and residential homes, working with the staff there to care plan for those patients and to really provide the best package of care for them, looking at all their needs, not just their medical needs or their particular health needs. Part of this role allows me to link in with the wider multidisciplinary team, not just for the care planning, and also secondary care, that I can refer patients to consultants if necessary. I then follow up on whether that has been done, what they have recommended from that, and provide those links between primary and secondary care. Well, for somebody considering a role as an advanced nurse practitioner, I would say absolutely go for it. It's a wonderful role. You're working in a team with other nurses, the wider multidisciplinary team, your general practitioners. You are very supported. Whilst being able to be an autonomous practitioner, you have that backup and that moral support as well. You have always people to go to for advice and people who will encourage you in your continual professional development, so that your practice is evidence-based and you are providing that excellent service for patients, that you get the job satisfaction out of it, you also get the patient satisfaction. So the advanced nurse practitioner role allows you to collaborate and work closely with that multidisciplinary team, and really what we're doing is providing the right care for patients at the right time by the right person or persons.
Okay, so just moving quickly on then, the next slide shows advanced nursing practice outcomes. This slide depicts a 2-week snapshot of AMP activity within a primary care setting in a largely rural area of Northern Ireland, where 4 advanced nurse practitioners work autonomously alongside general medical practitioners in delivering primary care services. Review of this activity shows the number of consultations over 56 clinic sessions, which are mornings or afternoons. The activity breakdown highlights the valuable contribution of advanced nursing practice and the variety of clinical interventions, from assessing new patients, follow-up reviews, telephone liaison calls, prescriptions written, investigations ordered, and onward referrals made. This activity clearly shows the scope and value of advanced nursing practice and the positive benefits to patient outcomes. A further effective role emerging for the primary care ANP role is within care home settings, with positive feedback of the effectiveness of holistic advanced nursing assessment and care planning interventions, supporting vulnerable older people to maintain optimum health and well-being, and supporting care home staff to deliver high quality care. Further evaluation of the AMP role and a workforce model in Northern Ireland is needed as we endeavour to rebuild services and develop nursing practice further in the post-pandemic era. So thank you very much everyone for your kind attention today, and hopefully you've learned something from it. Thank you.